The goal of reducing suicides in the military, Secretary of Defense Lloyd Austin has ordered a number of improvements in access to mental health care. The orders involve areas where the department already has the authority to take immediate steps. Mike Gooding has the details.
The extraordinary men and women.
Defense Secretary Lloyd Austin this week ordered the Pentagon to improve access to mental health care in an effort to reduce suicide deaths in the military. Overall, the Department of Defense has seen a slight decline in active duty suicides, with DoD data showing 519 cases in 2021 compared to 580 cases in 2020. Still, that's 519 too many. Based on Austin's memorandum, the Pentagon will immediately expedite the hiring of behavioral health professionals and improve the scheduling system for appointments. It will also require military medical facilities to screen for unhealthy levels of alcohol consumption and would make it easier for service members to find help for unhealthy alcohol use.
While we recognize that suicide has no single cause and that no single preventative action, treatment, or cure will eliminate suicide altogether, we will exhaust every effort to promote the wellness, health, and morale of our total force, be there for one another, and save lives.
The majority of suicide deaths among service members, 64%, involved firearms. Yet the memo sidestepped a key recommendation having to do with personal firearms safety and regulation.
That'll be something that the working group will examine in further detail and come back to the Secretary with their assessment and their recommendation.
Mike Gooding, 13 News Now.
The Pentagon Suicide Prevention Working Group is expected to complete its work by June 2nd.
One thing that could help with the military suicide problem, the Brandon Act. The measure is named for a Norfolk-based sailor, Brandon Caserta, who took his own life in 2018. The act became law in 2022. Under it, if a service member seeks mental health services or self-reports a problem, they're supposed to get a mental health evaluation and confidential help outside the chain of command. But the DoD still hasn't issued guidance to the services to put the bill into practice. Virginia Senator Tim Kaine this week pressing the Pentagon to take action.
We need to see that report about implementation. We need to see it soon. We need to understand that this is not some box checking thing that people are doing just to appease us, but you're doing it to meet a need that is a very significant one.
Kaine says not taking action on the law is a re-victimization for the Caserta family. He added they will view that as yet another pain that they are suffering at the hands of the United States military.